Hello, I'm Dr. Kandekar with the OSU Epilepsy Division here to talk to you today about epilepsy diet therapy.
And my name is Emily Vandenberg. I'm a dietitian that works with the Epilepsy Division.
So today, these are the learning objectives for today's talk and the overview of how we're going to organize information for you. So first of all, diet therapy for epilepsy has been around for a long time. Initially, the link was discovered way back in 1915. And it was used originally for children with drug-resistant epilepsy. Around the 1940s, interest in diet therapy sort of waned due to medications becoming, due to development in medication, that became the mainstay of treatment. Later on in the 90s, there was more interest in this again, particularly with this high-profile case of Charlie Abrams. And then, but still, even at this point, it was still used primarily in children. And then in the early 2000s, the modified Atkins diet was developed, which was a more a less restrictive version of the diet that was more doable for adults. And then at Johns Hopkins, they discovered that it was effective as well. And then interest steadily grew after that over the next 20 years. Several studies were done in adult and children population up until just recently in 2021 or 2020, the first clinical guideline for diet therapy in epilepsy in adults was developed. And then in 2021, we're now at the 100th anniversary. So who is the epilepsy diet therapy for? As I said before, it was used primarily in children with drug-resistant epilepsy, which is about 30% of the patient population. That would be for the classic ketogenic diet. But now with the less restrictive diets, it could be a good option for anybody. It's not a cure. Most people will experience about 50% reduction in seizures. And there's currently a lot of research going on in the benefits in other sorts of conditions, such as Alzheimer's disease, Parkinson's disease, cancer, and so on. Particularly the classic ketogenic diet may not be a good option if you have certain types of conditions, particularly type 1 diabetes, heart problems, GI problems, and any sort of condition that gives you abnormal ability to metabolize fats, because most of your energy with this diet is going to come from fat. The more restrictive the diet is, now there's several different options. But the most restrictive classic ketogenic diet is really not a benign type of thing. That's why that was another reason why it really wasn't used in adults very, very often. We have lots of issues, including possible osteoporosis, kidney stones, weight loss that may or may not be a good thing depending on the situation, and high cholesterol, because most of your calories, as we said before, is coming from fat. So I'm going to hand it over to Emily to talk about the options and the practical considerations of what these diets entail.
Yeah, so the classic ketogenic diet is the one used most often in children and is definitely considered the most restrictive option. All foods have to be weighed on a food scale. Fluids are restricted. Fat is the main component of the diet. And then we provide just enough protein and minimize the carbs as much as possible. In adults, we most often use what's called the modified Atkins diet because it is a little bit more liberal, as you can kind of see from these different pictures here, the different pie charts and the ratios of macronutrients. children, it's a little bit easier to follow the classic ketogenic diet because they are not in control of their diet. Usually the parents are the ones providing the food, weighing the food, preparing the food. For adults, it's a little bit harder to follow that classic ketogenic diet. So we use this modified Atkins just to allow for a little bit more choices and options while still being able to achieve ketosis and a reduction in seizures. Some of the other options on here aren't as common, including the low glycemic index diet and the MCT diet. The MCT diet uses a lot of MCT oil, whereas the other diets, we may use it to supplement the fat sources and help someone get into ketosis, but it's not a main component of the diet.
So we're gonna focus mostly on modified keto or modified Atkins here. Well, why don't you go ahead and talk more about the classic ketogenic and the modified keto at this point?
Yeah, so the classic ketogenic diet, at least 90% of the calories are coming from fat. The most strict form has a 4-to-1 ratio of grams of fat to grams of carbs and protein. Like I said, fluids are usually limited. It can be hard to get enough calories and enough protein on this particular version. We try to keep carbs as close to 0 as possible, and all foods have to be weighed using a food scale to make sure that we're hitting those correct ratios.
And anything to add about the modified ketogenic diet?
It's a little bit less strict, still pretty difficult to follow, and is used more often in children. It allows for some other ratios of grams of fat to carbs and protein. It can range anywhere from a 1-to-1 ratio to 3-to-1. So this is, like I said, the version that we use most often in adults, because as you can see from that pie chart, it allows for much more of the calories to come from protein and carbs. Foods don't have to be weighed. Fluids aren't necessarily restricted. It's something to point out is it's not a high protein diet. Sometimes people think that this diet is the only thing you have to keep an eye on is the carbohydrates, but that's not the case. We can't go overboard on protein either. We want to make sure we're getting just enough and fill in the rest of those calories with fat sources. Typically, we start someone around 40 to 50 grams of net carbs, and then we usually have to taper down from there in order to get into ketosis. There's a few people that might be able to achieve ketosis at 40 grams per day. But it's a little bit difficult and it depends on the person. So sometimes we have to go lower down to about 20 grams per day. To put that into perspective, a standard slice of bread has about 15 to 25 grams of carbs, depending on the size of the loaf itself.
We won't really get into the low glycemic index diet that much here. It's not as commonly used. And we will now go over some sample menus here.
So this is the classic ketogenic diet. As you can see, all the components or most of the components on this sample menu are listed in gram amounts, gram by weight. Whereas you'll see on the other sample menus, it's in standard household measurements such as a half cup or a cup. Because again, with this classic ketogenic diet, we have to be very specific and accurate and weigh all of these foods. So a sample breakfast would be eggs, scrambled with heavy cream in order to add fat, butter again to add fat, some spinach and mushrooms to get a little bit of fiber, and then the olive oil as well, add some extra fat along with this additional butter and coconut oil, and then coffee with cream, again, add some more fat. So at the end of perspective, a large egg raw is about 50 grams. So this is about an egg and a half. Lunchtime, Mixed greens, avocado adds your source of fat, some hard-boiled egg for protein, bacon, shredded cheese. We do allow for some snacks, again, pretty high fat coming from the cream cheese. And then you can see dinner there. We've got chicken for protein, some vegetables, and then a lot of fat coming from the olive oil and the pesto. So this is the modified Atkins diet. You can see it's different here because it's just listed in standard household measurements. Again, that makes it easier to follow and you're not having to weigh everything. Still got a lot of fat coming from butter, cream, mayonnaise, blue cheese dressing.
So the types of food are pretty similar. Well, one of the biggest differences, though, is depending on how strict we're going, is whether or not you need to weigh the foods. We won't get into this one too much. We'll move on.
So this slide just has some foods that are common in both types of diets or most types of ketogenic diets. They're going to be high in fat. So like your oils, creams, mayonnaise, like we've mentioned, butter, cheese, avocados, olives, all of those are sources of fat and are commonly found in the different variations of ketogenic diets. And then your protein sources. All protein sources can be included in the different variations of ketogenic diet, just the amount varies between the diets is the biggest thing. And then most of your non-starchy vegetables, like your spinach, kale, lettuce, most of those have very few carbs. And if they do, the fiber, it's usually coming from fiber. So those are usually considered like a free food for most ketogenic diets. This slide just has the common categories of foods that will need to be avoided with most ketogenic diets. So it's going to be anything that's high in carbohydrates. Typically that's your grains in the form of pastas, bread, rice, tortillas, anything made with flour, any type of fruit, whether that's juice, it's fresh, dried, frozen, any form of fruit will have carbohydrates. Starchy vegetables like potatoes, peas, corn. Milk and yogurt have both added and naturally occurring carbohydrates, so those will have to be avoided. Anything with sugar added, so sweetened beverages like sodas, lemonades, sports drinks, desserts, cookies, and then, common snack foods like chips, pretzels, and of course, pizza, everyone's favorite. So another thing that we ask people to do that are following this diet in order to determine whether they are actually in ketosis is to check ketones. And this can be done a couple of ways, but the easiest way is with urine ketone strips. And these can be found easily over the counter at pharmacies or purchased online. And we, after starting the diet, after the first couple of weeks, we asked people to start checking urine ketones. And you can kind of see in the picture there, you compare the strip, the color that your strip turns to the chart on the bottle to determine, how many ketones are in your urine. And ideally, we want to be in that darker purple stage above 40 milligrams per deciliter. The other option is testing blood ketones, and you can get a meter online. It's similar to a glucometer. If you know someone that checks their blood sugar at home, it's very similar to that.
Actually, before we move on here, I guess we didn't really get into what exactly all this part means. What the diet, the goal of the diet is to get your body to start using fats as fuel rather than carbohydrates. And this term ketogenic, meaning that these ketone bodies are a product of your body using fat for energy. And this checking the urine ketones is how we figure out if that transition has occurred. How it actually stops seizures is a matter of debate and continued research. So we should have probably got into that at the very beginning. So anyway, we'll move on here.
Yeah, so because this diet can be pretty restrictive and, we're eliminating a decent amount of foods and food groups, we still want to make sure that everyone is getting the micronutrients that they need as well, those vitamins and minerals. So we usually need to supplement those with an over-the-counter supplement, a multivitamin depending on age and gender. We want to look for one that's carb-free or as low carb as possible, so it's not taking away from the carbs in the diet. Calcium, vitamin D, potassium citrate, it's not as commonly needed with the modified Atkins diet as it is with the classic ketogenic diet. Sodium, the ketogenic diet has a natural diuretic effect, and usually in the first couple of weeks you lose some water weight, and we will get into this later, keto flu, but extra sodium can help reduce those symptoms. And then oftentimes we need a supplement of fiber because we're cutting out fruit and whole grains. Naturally the diet becomes lower in fiber. So a lot of times we need to supplement that, or in some cases, people need to use an over-the-counter laxative to help regulate bowel movements.
Okay, so I'm going to get into some of the studies that were done that led to the use of diet therapies in adults. So as mentioned, as early as the 2000s, there was this interest in less restrictive diets that was found to be more effective in children. And then in 2000, the group at, or 2008, the group at Johns Hopkins started testing it out in adults. So the very first one, the first study was done in a small population of 30 patients. What you'll see here is, as we mentioned before, about 50% of people had some kind of response. Some people had a really great response, but because it's a bit of a lifestyle change, it was difficult to continue for many people. So there was a large portion of the patients who were not able to continue it more than 3 months. The typical side effects, as we discussed before, is what they found here as well. Weight loss, high cholesterol, but for the most part, some of the more worrisome side effects that we see with the more restrictive diets, what we're not really seeing. Then about 8 years later in 2016, there's a much bigger study done with 168 patients testing modified Atkins and modified ketogenic diet. They split the group into different types of people. So we had people who never tried this before. There were people who were already on some kind of diet therapy, and then there were people who had drug-resistant epilepsy, that their seizures didn't stop with medications alone. And once again, we saw a pretty good response, not a cure, but many people did see some kind of improvement. Even the most difficult cases, the drug-resistant group, even that in that group, there was a pretty substantial improvement. And just like with the earlier study, it was very difficult for people to stick to it. About half or more of people in the study ended up dropping out. And then we also saw the same typical sorts of adverse effects, weight loss, high cholesterol, but none of the really serious ones that we worry about with the classic ketogenic diet. So that being said, we know that there are various risks to doing particularly the more restrictive diets, and we touched on many of them, and we have various ways of dealing with it if those things pop up. very early on, if you make the transitions too quickly, you may have various symptoms like nausea, vomiting, lethargy. Your blood may become too acidic. You may have way too little sugar in your blood as well. So the way we deal with that is hydration and trying to ease people into ketosis rather than trying to do it very quickly. As mentioned before, you don't get a lot of fiber, particularly the more restrictive the diet is. So sometimes we have to supplement either with more fibrous food or sometimes even a laxative would be needed. With high cholesterol, often this can be dealt with by simply adjusting the diet and the types of foods, and particularly avoiding unsaturated fats. But sometimes it's necessary to add a medicine to control the statin. There is a risk for developing kidney stones, once again, more so with the more restrictive diets. Usually we can avoid this with good hydration and supplements to alkalinize the urine. Weight loss may or may not be considered an adverse side effect. For some people, it might be a good thing. But for people who already have a low baseline weight, this can be problematic. And really the way we deal with this is to make sure that the actual caloric intake is adequate. And so sometimes it'll be very difficult to get all the calories you need just from fat. And this is just going to be a matter of planning and adjusting with the diet itself. There are various nutrient deficiencies that people on the diet can be at risk for, including things like zinc, selenium, iron. So that's why we showed you supplements earlier to help avoid some of these types of issues. And then the hypoglycemia, as I mentioned before, is more of an issue when ramping up a diet too quickly. So that's when your blood sugar gets too low before your body is used to using fats as fuel rather than sugars and carbohydrates. Let me have you talk about the keto food.
Yeah, so it's pretty common to experience flu-like symptoms when starting the diet, especially if we cut back on carbohydrates really quickly. It's just a big shock to the body. And the way that we can try to avoid some of these flu-like symptoms is by slowly tapering down those carbohydrates. For example, maybe you're currently eating 200 grams. So maybe we cut it back by 50, every week for a few weeks, just to slowly ease your body into that state of ketosis. The other thing that we recommend is using a carb-free electrolyte solution like Gatorade Zero to help increase those fluids and sodium in addition to your normal fluid intake.
So we talked about a lot of the possible adverse side effects. We mentioned earlier that the different situations where it may be helpful to this diet, aside from epilepsy. So people with type 2 diabetes, if you're obese and trying to lose weight, this can help. It's also thought to help with cognitive impairment and mood disorders. And as we mentioned earlier, that there's active research on the effects of the diet in other conditions such as brain cancer and Alzheimer's disease. You saw from our review of the studies that in general, the biggest challenge is sticking to the diet. It's a big lifestyle change. It's difficult to change your eating habits, but the people who have the motivation to stick to it typically see some kind of improvement. This type of therapy is not really on the radar for most adult neurologists. I think our institution is the only one in Ohio that's doing it, as far as I know, and there's only a few other neurology practices around the country that have a program for for doing diet therapy in adults. Most children's pediatric neurology centers are already doing this. And then some of the challenges that in particular my patients have come into, so a lot of them have complained about the cost of being on a specific diet, although that, our dietitian, when she sees patients, will take this into effect. Usually this can, or take this into account. So this can also usually be dealt with. So we have the ability to do it here. I'm just going to plug our program here real quick. So we have Emily, our dietitian, is seeing the patients, and our vocologists we have developed a clinical practice guideline for doing this. The way that we usually will do this is have patients start off in a group class to learn more about the diet and gauge their interest. And the people who are most interested will start seeing us one-on-one sessions with our dietitian and lab monitoring by our physician to monitor for side effects. So our take-home points here are the ketogenic diet is a low-carb, high-fat diet. You can't, cheat at this. It's only going to work if you can stick to it. Most people that try this, about 50% of people will see at least about a 50% improvement in their seizures, and it should be tried for at least 3 months before saying it didn't work. It's not meant to take the place of medications. You mentioned before, it's not a cure, but it's an excellent adjunct, and particularly with the modified Atkins diet, it's a very low risk addition to your treatment. And it may have other benefits such as weight loss and improvement in mood and cognition. Here are some resources if you want to learn more about epilepsy diets, therapies, and we'll take questions in our question and answer session later. So that does it for us. Thank you for joining us. I hope you found this useful. And we'll see you later.